Cutting off option 3 for LGBTQ plus youth and young adults is only one massive swipe at the Trump regime is implementing. The obnoxious, destructive, damaging, one big, beautiful bill that the Twisted Tangerine wants to have on his desk by July 4th has stumbled into some roadblocks in the U.S. Senate. The Senate Parliamentarian, Elizabeth MacDonough, is advising Senate leaders that parts of the spending package violate the Byrd rule. In the Senate, non-budgetary measures require 60 votes to end a filibuster, meaning that some Democrats must support most bills for them to pass through Congress. Budget measures can pass with only 50 votes, though under a process known as reconciliation. House Republicans passed the One Big Beautiful Bill Act last month and included bans on Medicaid and CHIP, paying for gender-affirming care for transgender people. The House version also banned policies sold in healthcare exchanges established by the Affordable Care Act, also known as Obamacare, from covering gender-affirming care. If passed, these measures will be devastating for transgender people who depend on these programs for healthcare and could force people to detransition. But the Senate parliamentarian Elizabeth MacDonough ruled earlier on Thursday that these measures violated the Byrd rule, which only allows budget measures to pass under reconciliation, Axios reports. This means that the Senate will need to secure the support of at least 7 Democrats to pass the bill with these measures included. Governor Josh Shapiro warned in May that the Medicaid cuts Congress is considering would mean billions of dollars in lost federal aid to Pennsylvania, hundreds of thousands of people losing their access to health insurance programs, and more struggling rural hospitals shutting their doors. I just need to stress there is no backfilling at the state level, Shapiro told WILK FM radio in Wilkes-Barre. There are no dollars available at the state level to make up for these cuts at the federal level. So if they cut someone off Medicaid, they're off. We will not be able to fix that for them. Besides hundreds of thousands of people losing access to Medicaid in Pennsylvania, billions of dollars in funding cuts would accelerate the shuttering of rural hospitals, which are teetering on the brink of closure, Shapiro said. U.S. Senator Elizabeth Warren made several of the same points. Here now from an interview with Jen Psaki on MSNBC is Senator Elizabeth Warren.